The patients on all of these beds and in all of these rooms share a dangerous combination: unvaccinated and severely ill with COVID-19. They are part of a deluge straining a healthcare system grappling with this country's deadliest COVID wave. They're patients at Moscow's Sklifosovsky Hospital. It was built in 1810 and today has the country's largest emergency department. As doctors and nurses arrived for their morning shift, we were invited along, which meant suiting up in several protective layers, including a gown, goggles, and 2 sets of gloves. Leading the team, the hospital's director, Dr. Sergei Petrikov, who says COVID has him on call 24 hours a day.
Now we have 100 patients on 98 beds.
And all of them are cordoned off in the red zone of the hospital.
Our work is to treat people, and it doesn't mention they're vaccinated or not vaccinated.
As the large medical team reviews the images and charts, they're able to speak with some of the patients, but others are in medically induced comas.
On all of the doors list the names and ages of the patients, and in some of these rooms in the ICU hooked up to ventilators with COVID are some patients in their 20s and 30s.
But the majority are elderly, and like 74-year-old Lydia Garilova, regret not getting the vaccine.
Господи, ничего страшного. Сижу дома, ничто ко мне не прилепится. Все будет нормально.
But now many are on ventilators and even ECMO machines, a last resort of life support. Dr. Yevgeny Rybov is an administrator in the COVID department here.
Это страшно глядеть в глаза родственникам. Я бы не хотел на эту тему говорить, потому что это очень тяжело, именно потерять близких людей. Это очень тяжело, понимаете? Тяжелее этого ничего, наверное, нет.
According to official statistics, around 1,100 people died of COVID every day in Russia over the past week, but the government has been accused of distorting the numbers. At this hospital south of Moscow, there are reports that not all COVID deaths are being counted, and some believe the true toll of the virus is much higher.
I project that for October, that will be almost 100K excess deaths, and for November, 120, 140K excess deaths.
Alexei Raksha used to work for the state statistics agency but was forced to resign in 2020 after voicing concern about how COVID deaths were being counted. He believes if Russia gave a clear picture of how many are dying, it might change behavior.
I think that maybe more people got vaccinated, the more people take this virus more seriously and make some precautions measures.
Back in the hospital, since the beginning of the pandemic, officials had to bring in 300 medical students just to cope. The relentless pace is draining for the staff, who, despite the PPE, still find ways to support each other through it all. After the morning rounds, the hospital director told us that some of the staff went to a memorial for a former colleague who died of COVID.
Это самое тяжелое, когда ты хоронишь людей, которых ты хорошо знаешь.
Earlier in the ward, Petrikov told one man that the evil was starting to leave his body because the patient was breathing more easily. But when it comes to the COVID crisis, he thinks the only real way out is through vaccines. And there doesn't appear to be much light at the end of that tunnel. 60% of Russians don't have a single shot. With a partial lockdown set to expire Sunday in the city, this hospital ward won't see much relief anytime soon. Briar Stewart, CBC News, Moscow.